Hello and welcome to Noah Scrolls on Noah TV. This is Dr. Zoma Mobani, and today we're going to continue with our Pickup Scrolls with the discussion of menopause and its symptoms. As you all know, I'm a urogynecologist, and as a urogynecologist, we deal with vagina all day. And so menopause comes to mind when we talk about the age range of the females that usually present with complaints about their gynecological and urological system. So menopause, what is it? Menopause is actually the cessation of ovarian function. Colloquially, in the outside world, women see it as when the periods finally come to a full and screeching stop. But the period stopping is not really what the menopause is all about. It's about the ovaries actually completing dancing out. And a little bit of information about how the female menstruation happens. The female menstruation is a physical sign that your ovaries are cycling. When a female child is born, the female baby is born with her full armamentarium of ova in very suppressed state of development. And when the brain function gets to a certain level and incites the ovaries to wake up in the process called menarche, which is the first period, it means that that month a couple of eggs have started to grow in an ovary and have reached a particular size, and an egg has been released. That means that the female child is now able to become a mother, to have a baby. Now, when that egg is released and does not result in a pregnancy, this cavity that the egg is released from bleeds into itself and turns into progesterone producing cells. The hitherto granulosa cells that fed the egg will now start producing progesterone that will help keep the lining of the uterus that hitherto grew while the egg was growing in the ovary in preparation for a possible pregnancy. After 14 days after the egg is released, by and large, if no pregnancy results and no human chorionic gonadotropin from a pregnancy is in the system, that progesterone producing corpus luteum of menstruation dies or begins to die. And when it stops making progesterone, the uterus sheds what it prepared that month for a potential baby. And that's what we see as a period. So the first period in a female signifies that her ovary, one of them usually, has woken up from childhood sleep and has now started to make eggs. And in a normal pattern, this happens on a monthly basis up until that female reaches a critical age again, which is in the mid-cycle ages, and in America is between 41 and 51 years of age, when that ovary now becomes old and can no longer make the eggs anymore and slowly dances out in the process we call perimenopause. Perimenopausal age or years are the years that herald a complete cessation of ovarian function. In those perimenopausal ages, some months the ovaries remember to ovulate and make eggs, some months they don't. And in that way, or in that fashion, the menses do not come every month. Sometimes they skip a couple months. Sometimes you have them twice a month. Essentially, it's a period when both the ovaries and the uterus are confused because they've lost their cyclicity of monthly cycling and the ovaries about to pack up. Now, when a female does not see her menses for 12 full calendar months, we regard it as full menopause. That means the ovaries have finally gone to a final sleep and they're no longer making eggs. And the uterus sleeps as well because there are no more hormones to input its growth and its breakdown in the process called menstruation. Now in comes the hormonal part of it. So when we are menstrual and having monthly periods, we are having an ovarian cycle that makes estrogen preponderantly in the first half of the cycle and progesterone preponderantly in the second half of the cycle that creates the menstrual cycle. Believe it or not, this hormone is what makes us youthful. It's what maintains how we feel, our youthfulness, our energy, our beauty, and most especially maintains the function of both our external and internal gynecological organs. It makes those places feel happy. It drives blood to that area because we are still the citadel of life. The ovarian function tells our brain that we are about to have babies or we can have babies, so the brain orders the heart to send enough cardiac output to the uterus and its accompanying organs by default, so that nutrient-rich blood is always there, so these tissues are in their tippy-top form. By that same premise, we don't have problems with intercourse. There is no pain with intercourse because the vagina is rugous, thickened, and full of blood supply and makes lots of juices that makes making love very pleasurable. Also, not much of pain with anything because that place is quite very much youthful. But out goes all that process when menopause starts, and then slowly the areas start to ail. They start to show us symptoms and signs that they don't feel so hot. And what are those typical symptoms in the female? First and foremost, most people notice in their perimenopausal years a lot of hot flashes at night. And that could also come to happen during the day. These are sudden feelings of being in an incubator, in an incinerator, so to speak, where your body feels really hot for split seconds, sometimes for minutes, and then dies down and you feel cold again. Also, there's lots of energy urban. That's when women add a lot of weight. They wake up with pains in joints of different areas that could actually be very much debilitating. And slowly will come in decreased libido, pain with sex, and of course, dryness of the vagina and its environs. This essentially affects us in a very deleterious manner, affects our psyche, affects the way we feel with ourselves, affects our self-confidence. Also, weight gain comes in there because our BMR tends to drop a whole lot during menopause. So if you are in the menopausal ages, or if your periods have not been there yet for 12 months and you're experiencing all the symptoms I mentioned, you are in menopause, and we are here to help at NeuroWorld because we can help you navigate through the process and help reverse almost all of your symptoms and give you your life back in your second half of your life here on earth. Thank you for listening, and I hope I see you at my second series on menopause, genitourinary syndrome of menopause, and its treatment. This is Dr. Mobani signing off from Newer TV. Bye-bye.